let me share with you some information on chiropractic care. Before I do that, I meant to also tell you a few weeks ago when I was giving you some of the organization administration information about healthcare in the military, I shared with you this group of guys from the Lone Survivor movie and situation that unfolded there. And actually, one of them I meant to share with you, the gentleman on the far left here, was actually an SDSU student at some point. I believe he graduated from here. I'm not exactly sure where his academic course took him, but nonetheless, Matt Axelson, you'll see his name if you look at the Veterans Monument outside the Student Center over by the Starbucks. He was one of the individuals that died in that event. So what I'm going to share with you today is a little bit about chiropractic services. We're going to try to touch on most of these topics and end with how to answer the question that your patient is going to ask you at some point: should I go to a chiropractor? The other part of that is PT enough? So we'll answer that at the end. First of all, the theory, the basis upon which chiropractic services are provided in the education kind of background theory basically comes from the subluxation theory. Other times it may be referred to as segmental dysfunction theory or neurobiomechanical lesion theory. Basically that a misalignment, malalignment of a vertebrae or multiple vertebrae restricts, obstructs the nerve flow, and affects the body's ability to function the way it's supposed to because of the altered nervous system. And that effect on function can affect musculoskeletal function, can affect visceral function, and that's why you might hear of people going to the chiropractor to address their allergies, to address intra-abdominal issues, for pregnancy. So a variety of things that you may hear of patients going to a chiropractor for, and it's largely based upon this foundational theory that if you improve the vertebral alignment, you improve the body's ability to have its normal neural flow and improves the overall health of the system. The genesis of the term chiropractic, basically the two words mean treatment done by hand. Here's a little snapshot of the academic preparation that's part of chiropractic academic program. This content here was actually taken from the Palmer Chiropractic College, which is out of, I believe it's Davenport, Iowa. And Palmer Chiropractic was one of the first, may have been actually the first chiropractic school, and they've got branches, I think, on the East and West Coast now, I believe in Atlanta, and I think maybe somewhere out here in California as well. But nonetheless, chiropractic programs, fairly similar academic requirements that they have, and you can see here, bear some similarities to PT. Some of these things you might see on this list may be prereqs for some PT programs. Some of them are included within some of the DPT coursework that you've had. You see here there's a couple of PT 1 and 2, rehab and exercise 1 and 2 courses. Those PT courses are actually termed physiotherapy. And in looking within those course contents, they're really about instruction and usage of modalities, equipment, that sort of thing. But the overall coursework for the chiropractor is 3 to 4 years, pretty extensive, includes a significant amount of clinical seminars, clinical rotations, again, similar to your coursework as a DPT student. Prerequisites to get into chiropractic school are, most cases, it doesn't specify that I saw that they have to have a bachelor's degree, but more or less 4,400 hours of instruction in 4 academic years is in most cases going to lead to that bachelor's degree. And you can see here from the prerequisites, pretty similar to a lot of PT schools, a little bit of range of variety of what they will allow. It may not be quite as prescriptive as prerequisite requirements for PT schools. Before I touch on scope of practices, let me go back to their academic preparation. Chiropractors also have post-professional training course options somewhat similar to the PT orthopedic clinical specialist or sports or women's health clinical specialist. Chiropractors also have post-professional kind of focus areas that they can go into as well, and those can include things like acupuncture, radiology, where they actually have some residency programs in some of these areas, nutrition. So they too have a fair amount of post-professional training opportunities that lead to somewhat advanced credentials. Sports chiropractor is another advanced kind of practice setting. Once they get their license as a chiropractor, they have a scope of practice just like you're going to have once you have your PT license. And in the state of California, that scope of practice is similar in length, about 60 pages. And as I read down through that in preparation for this, I found some interesting things that are included specifically, and those are that they can prescribe or recommend use of vitamins and food supplements. We know that they can do radiographs. A lot of them have that capability right there in their clinic to perform those. I would say a large percentage of them do. They can do diagnostic ultrasound and treatment modalities. A statement that was also in the scope of practice is they cannot advertise themselves as being licensed in or practicing, quote, physical therapy unless they hold such a license. Now, you are going to actually cross paths probably with individuals who are dual licensed as a PT and a chiropractor. A friend of mine teaches at a PT school here in California, and they have a couple of different options for their training programs, and it affords opportunity for individuals that are already in a profession to come back and pursue DPT. And they've had a couple of chiropractors in each of their last few classes. So you will encounter those individuals that are dual licensed, and certainly they would then be able to advertise both, quote, physical therapy services and chiropractic services. A little bit on utilization of chiropractic care in the United States from this national center that you see the link to up top here. This is a 2007 survey. It takes a while for them to put everything together and get out the information. But they found that there was 8% of adults and 3% of children in the United States from their survey that received chiropractic or osteopathic manipulative therapy in the past 12 months of their survey. So the OMT services are just spinal manipulation, could be peripheral manipulation as well, but those services may have been provided by someone other than a chiropractor, not PT, but they explicitly mentioned doctors of osteopathy. So the vast majority of these encounters, though, for manipulative therapy were likely from a chiropractor. And this was associated with $4 billion in out-of-pocket costs, so not insurance covered, and $12 billion in overall complementary health practitioner services. What type of practitioners fall under complementary health? Well, some examples are acupuncturists, massage therapists. PT and OT, I believe, are under a different umbrella and not within the complementary health group. But I have to go back and look at that to be sure. Of those that accessed chiropractic care, 74% had a history of low back pain. The American Chiropractic Association is a very effective and powerful political lobbying group. They are very good at marketing chiropractic services, and chiropractic care is a direct access benefit in all 50 states. You see here an example of their marketing effectiveness, basically stating that patients who had a doctor of chiropractor as their, quote, primary care physician had significant decreases in hospital admission, hospital days spent in hospital days, less outpatient surgeries and procedures, and less pharmaceutical costs. So, that's a compelling marketing component. There's some questions you could ask from that. Maybe some of those things are less just because the chiropractor didn't have access to some of those services, perhaps. Or as a result, the patient paid for them out of pocket, for example, pharmaceutical costs, and it didn't show up in however they queried their data. But nonetheless, the chiropractors do a very good job of marketing and campaigning on the political front. You'll see this as well oftentimes in competition or opposition to the physical therapy efforts by our profession to expand the Practice Act for PTs. Most of the time that is met with opposition from other healthcare groups, and typically the chiropractic or the ACA is one of the opposing groups. I can't think of any examples of when they have been on the side of PTs, and that goes both ways. It's a little bit of a protectionist approach, but nonetheless, you can see here how they do some of their marketing. And again, just keep in mind that they're direct access. They can get referrals, or patients can get referrals to a chiropractor. That might help in some of their insurance reimbursement, perhaps, but it's usually not required. Reimbursement for chiropractic services is often covered by a lot of HMOs, private health insurance, Medicare, and other workmen's compensation systems. So similar to PT, again, there's caps to it. You'll see that a lot of chiropractic clinics will have kind of maintenance program type of things or continuation programs that will change the rate for patients or provide a certain rate for them to continue care on a cash-based basis once their insurance benefits are up. And you'll have to see how much of that you see in PT clinics as you get out in the profession and see if it follows some similar practice models. So the big question is how to answer your patient who asks, should I go to the chiropractor? Can you refer me to the chiropractor? Well, let's start with, should I go to the chiropractor? I ask the patients, have they been to a chiropractor before for this problem? And if they say yes and that it helped, oftentimes I'm going to go ahead and recommend that they go back there then. That's kind of that biopsychosocial partnering with the patient, basically. If the patient's had a positive experience, that's probably in the back of their mind of, I should probably go there, but my doctor referred me to PT type of thing. Now, if it's a rather straightforward situation that I feel that we can provide a similar type of care, similar type of spinal manipulation, and I think they're going to respond well to it, I will tell the patient that, and I'll say, give us 2, 3, or 4 sessions of treating you. We provide some of the very similar, maybe even same type of manipulative techniques that you've likely received from the chiropractor. So let's try it a few sessions here. If you feel like you're not making progress in the military environment, I would refer you. In the civilian environment, they can just pick up the phone and call the clinic themselves. They typically don't need a referral. So the other scenario would be asking the patient, if they're asking you the question about going to the chiropractor, if the patient responds that they haven't been to a chiropractor before, I typically ask them, are you interested in having somebody pop your back? Patients are usually pretty quick to give you an answer to that. Either they definitely are interested, or some of them are not sure. Some of them outright say, no, I don't like that. Well, if they're in the not sure or I don't like that idea, then that kind of opens the door for you as a PT to steer the interventions away from manipulative therapy, unless you feel that they're absolutely needed. But even in that patient that says, I definitely am not a fan of that, then you probably want to go for one of your other tools in the manual therapy realm of muscle energy type of approaches or joint mobilizations, Mulligan, McKinsey techniques, things like that, to oftentimes produce a very similar effect. So a lot of different ways to approach that. But ultimately, keep in mind, the chiropractors can be a very effective part of the healthcare network. One of your jobs, so to speak, as a early professional is to start creating that network of trusted professionals, both within our PT community as well as other healthcare providers, to allow yourself that communication back and forth. As you occasionally refer patients to another healthcare provider, you will likely in turn reap benefits from that and getting referrals back as well. Also, some chiropractors are very good in the same things that we do, the same things that we think we're good at. I've worked with some chiropractors that are very good in exercise. And I've worked with a couple that are very good in other types of manual therapy besides manipulative therapy, or in addition to manipulative therapy, I should say. And I've worked with a couple that they weren't real strong in those other areas. They were good manipulative therapists, but they were really good with biopsychosocial things and very good with patient education. And so most of them have some other strengths in addition to manipulative therapy. And those are good things to kind of know about, because none of us are going to be 100% successful with our patient. And ultimately, it's about helping the patient get better, get back to what they need to be doing. And if you can create that network of trusted other healthcare professionals, those individuals will refer patients back to you. Your patients will also advocate for you in those cases, and probably serve as a resource of referring patients to you as well at times. So hopefully this has provided you a little bit of insight into the world of chiropractic care. In the military and other federal healthcare organizations, the PTs and other healthcare providers seem to work very well together. There's not that issue of who's going to get paid for this visit. In the civilian sector, I think there's a little bit more challenge to that because there's a limited amount of financial resources to go around for that patient from their insurance company or from their own bank account. So it's a little more of a competitive environment in that regards. But ultimately, they're good colleagues to have. We can learn from them, as well as we can share some things with them as well for patient intervention. So if you have any questions, feel free to shoot me an email. Best of luck as you get ready to go out on the next 9 to 10 months of internships. I look forward to hearing about your adventures, and hopefully you get to enjoy a little bit of recovery time in between the comp exam and heading out 6 weeks or so after that. So safe travels, and stay in touch, and best of luck to you.